Hey guys, it's Leah B. I'm a former CMP examiner, compensation pension examiner, Army veteran, U.S. Army veteran, disabled veteran, physician assistant. And today I wanted to come on and discuss femoral acetabular impingement syndrome and how that can relate to VA disability. So a lot of you may have never heard of FAI before, but a lot of you actually might have, because a lot of people actually approach me to assist them with letters related to this condition. And a lot of you guys, when you're on active duty, I actually treated a lot of people for this condition as well. I was very fortunate to work with an awesome orthopedic surgeon who handled a lot of these cases from all over the military. They shipped them our way. So I think it's a really interesting case, and it's often really overlooked and a cause of hip pain. So what is FAI, or femoral acetabular impingement syndrome? So I'm going to show you guys a quick image of this by sharing my screen. Here we go. Okay, so you have what is called the this is the femur bone, the thigh bone, and this is the top of it, and it fits into this socket called the acetabulum, right? So what happens in a normal hip bone or a hip, articulation here is this top of this femur bone really just glides where it's supposed to, okay? And you can develop two different types of deformities, or you can have a mixed type called a cam or a pincer deformity. So the cam deformity is when the ball or the femur develops a little bit of an extra kind of growth of the bone here. And so as you can imagine, when it's trying to glide in this socket, it just starts tearing things up because it's got extra space there that it's not supposed to have. And then the pincer deformity is when, as you can see by the other acetabulum, they kind of are a little bit shorter. And this one has, where it's red here, it grows out a little bit longer. Okay. And that also can cause some disruption, or you can have a mixed type. And this can lead to things like a torn labrum. Some of you guys might not even know that you have a labrum in your hip, but you do. You have them in your shoulder too. And we can go over that on another day, but it can lead to tearing up that labrum. It can lead to arthritis eventually and cause a whole lot of problems, right? So let me flip back over to not screen sharing. Okay, so femoral acetabular impingement syndrome, a common cause of hip issues. It can be genetic. You can be born with one of these deformities. It can also develop over time in athletes, so people that are also in inactive individuals, right? But it can happen due to women or men. The cam deformity seems to be the most frequent type, and it affects younger male athletes. The pincer tends to affect women more in their 30s and 40s who are also athletic. This is associated with all kinds of sports, can be ballet, cycling, rowing, martial arts. In our population, veterans, right? And so that's definitely a big cause. So let's talk about some literature that I like to use, because I know that's something you guys seem to like a lot. So you can go to your primary care doctor or your orthopedic surgeon or whoever's treating you and say, hey, some of this literature, I've looked up some of these articles, show them to them, see if they want to include some of that language in a short note for you to help you get service connected. So one of the articles I use is called The Warrior Athlete, an illustrative microcosm of the war against hip femoral acetabular impingement. And that basically states that from an orthopedic perspective, our military personnel are truly warrior athletes. Distilling information available about these subjects provides an enlightening view of the management of FAI. Regardless of the suddenness of the onset of symptoms, it is a culmination of cumulative processes that has been developing over time. By the time they become symptomatic, there's often an appreciable portion of the damage that cannot be completely reversed. Okay, so that's just a good article about FAI in our soldier population. Another one, a retrospective study titled Femoral Acetabular Impingement Syndrome, is more common in military veterans with end-stage hip osteoarthritis than civilian patients. A retrospective case control study published in 2019 in Military Medical Research And I could go on and on about what they found in that, but it's also best if you guys just can maybe look it up. I don't want to bore you to death, but look up those articles and you can kind of see some of the literature that may be pertinent. I've got several others, especially on people with lower back injuries that can kind of also contribute to these things, because it can be from a secondary perspective, we can develop some of these things as well. So when it comes to ratings, this one's kind of tricky. Ratings are always subject to change. And I think it's always important to go over these things with your legal representative. But there can be different types of ratings. Let me pull it up here. You can have some ratings on different joints that include limitation of motion, like flexion and extension. You can have, if you've got to have a total joint replacement, different ratings come into that. If you develop, have the need for a total joint replacement eventually, pain and motion, arthritis, etc. So there are different ratings when it comes to that. You can always become individually unemployable from anything that causes you to meet a certain percentage and different aspects. But again, that's more of an administrative legal thing. So if some of these things are impacting your abilities to perform the functions of your daily duties, that's something to definitely take a look at as well. So FAI, some of you guys might not care about this at all, but I think it's super interesting. Because there are actually a ton of veterans that are suffering from this. So if you guys have any questions, please leave them in the comments below and I will be happy to answer them. And later on in a couple of weeks, I'll probably do another video regarding what happens in a CMP exam for hip pain, because I think those are kind of helpful to people as well. In the meantime, if you want to look up the DBQ, go to VA.gov and check that out. All right. Thanks for watching, guys. See y'all later.